Well, COVID-19 cases are now rising in all 50 states for the first time since January.
Here to answer your questions is Dr. Emily Heil, an infectious disease specialist at Mass General Hospital. Doctor, thank you so much for joining us this morning. We want to ask you, we imagine it is frustrating for you and your colleagues to see an increase. Can you tell us how our numbers in Massachusetts and the Northeast compare to everywhere else?
You know, it's a really sad time, I think, for healthcare workers around the country to see any rise in COVID-19 because we do have these safe and effective vaccines. We are seeing an uptick in Massachusetts and other northeastern states, but I would say that this uptick here is much smaller than in other parts of the country, and that's really due to the high vaccination rates that we've been able to achieve here. So even though we do see an increase, it is much smaller. And I think it really highlights what a good time it is for those who have not yet been vaccinated and are thinking about it to talk with somebody about the risks and benefits of vaccine, to get their questions answered, and to go ahead and get vaccinated.
True, no time to wait. The CDC director referred to the national increase as a pandemic of the unvaccinated. Is that what our data shows in this state too?
Absolutely. So the data that you may be hearing from the national media is that 99.5% of the COVID deaths now are among unvaccinated people. And we're seeing that here in Massachusetts as well. The state released data about our 4.2 million vaccinated people just this week and showed that only 79 of the deaths occurred among people who had been fully vaccinated. So more data from our state in particular that vaccinations are really effective.
We've also heard many times that younger people in their, say, 20s, 30s, and 40s are at a lower risk for serious symptoms or death. Is the Delta variant having a different impact on those age groups?
You know, COVID-19 is a cruel disease and very uncertain. So it's very true that from the start of the pandemic, we were seeing many more severe cases and deaths among older folks or people with chronic diseases. However, from the very start, we've seen severe illness among younger people as well. So I think, again, people who are younger who feel that they have no health problems and are concerned about the vaccine should really take the opportunity to talk with healthcare professionals about the safety and efficacy of the vaccine because we are seeing severe illness among younger folks without any other health problems. I'd also say that for people who have only had one dose of the mRNA vaccine in the setting of the Delta variant circulating widely, it is really important to go ahead and get that second dose, to talk with somebody if you have any concerns about getting a second dose, because we really are seeing a dramatic change in the effectiveness of one dose versus two doses of the mRNA vaccine for adults.
1 in 5 new COVID cases this week happened in Florida. Do you think Massachusetts residents should avoid traveling to hotspots right now, even if they're fully vaccinated?
It's such a good question. I think if you're unvaccinated, now is not a good time to be going to areas where there's a lot of circulating virus. It is a good time to think about getting vaccinated. And if you really have to travel and aren't able to be vaccinated or have too many concerns, masking is absolutely essential. For those who are fully vaccinated, I think this is really a risk-benefit analysis for each person. Our vaccines are incredibly effective, but they are not 100%. No vaccine is. And so if you're in areas where there's more circulating virus, even if you're fully vaccinated, there is a higher risk of becoming infected. And so for those who are fully vaccinated and want or need to travel to areas where there's a lot of circulating virus, I think it's a good time to consider those risks and benefits and potentially to mask if you are in areas where there's more circulating virus, even though you're fully vaccinated.
Very interesting. All right, Dr. Emily Heil, infectious disease specialist at Mass General Hospital. Thank you so much for joining us this morning.
Thank you. You're clear with the takeaway. Get the shot.